Thank you, everybody, for coming today. I'm quite excited about the opportunity to present this. I've been involved with the Canadian Student Tobacco, Alcohol and Drug Survey for quite a few years now. We used to call it the Youth Smoking Survey, but about 4 years ago, I think it was, we changed the name because we wanted to align it with some of the other Health Canada funded smoking surveys that were going on, like the Canadian Tobacco, Alcohol and Drug Survey. So, and we added some additional questions, so it wasn't just about smoking. We started looking at other socio-demographic variables that might be related to smoking, and we've added some questions on electronic cigarettes or vaping. So I'm going to present today some of the very hot off the press data from CSTADS on the use of the prevalence of electronic cigarette use by Canadian middle and high school students. So I just want to acknowledge funding from Health Canada for the survey. The lead group taking care of this in Canada is the Propel Centre for Population Health Impact at the University of Waterloo. The Canadian Cancer Society gave us a grant to do analyses and prepare manuscripts for publication based on this data. And I also want to acknowledge Joanne Thompson, who is the project coordinator, and she's here at CARBC, and without Joanne, we wouldn't have such high quality data. She's an expert recruiter. It's very difficult sometimes to get schools to participate in these kinds of surveys, so we're very grateful for her work in doing that. So I'm just going to begin with a little bit about the international situation. Those of you who are probably familiar with the smoking literature know that there has been a decline in cigarette smoking among young people in Canada over the last decade. Over the same period, however, electronic cigarettes have been introduced into the market and the rates of use have been going up. So we have an interesting situation where we have declining rates of cigarette smoking and an increase in the rates of e-cigarette use or vaping. Just as an example of the international situation, in the US in 2015, 16% of high school students reported using electronic cigarettes in the past 30 days. And I'm going to talk in a minute about some of the problems with the measures of e-cigarette use. But that was a significant increase from 1.5% in 2011 to 16% in 2015. So that's a pretty remarkable increase over that period of time. And in some countries now we're finding that e-cigarette use actually has surpassed cigarette smoking in some countries. Not yet true in Canada. It's close, but it's not true based on our CSTADS data. Whoops. Okay, that had me a little bit worried. So with the introduction of e-cigarettes in Canada and around the world, it has generated a very interesting but quite fierce debate in the public health community about the harms and benefits of e-cigarettes. On the one hand, we have groups of public health people who believe that e-cigarettes present a really excellent opportunity for harm reduction. On the other hand, we have a group of public health people who believe that e-cigarettes may be a gateway to cigarette smoking, particularly for young people, and that it may actually help to normalize smoking. So those are just kind of the poles, the extreme poles on that debate. But it has been quite acrimonious in the literature, and people seem to be interpreting the same data in very different ways depending on where they sit on that debate. In my own personal view, and based on the work that we have done, Tim and Renee and I, is that I do believe that concerns about the harms have been overstated, and more evidence is starting to emerge about that is confirming that. So just to give you a quick overview of the methods of this study, it's a biennial paper and pencil-based survey that is administered to students across the country. We survey students in grades 6 to 12, and in Quebec they're called 6 to secondary 5. And it's students who attend public, private, and Catholic schools in all 10 provinces. We have not surveyed the territories. One of the reasons is low numbers, and sampling variability would make it very difficult for us to report out on those numbers. So we do have a generalizable sample at the national and provincial levels, except in New Brunswick, where this last round there was a low response rate and moderate sampling variability. So we actually are not reporting out any of the data on New Brunswick separately, although they are incorporated into the national data. So we used a stratified single-stage cluster design. We broke them into strata depending on the smoking rates in the health regions and the type of school, and then randomly selected them within each stratum. We got ethics approval from all of the relevant ethics boards, including in BC and at UVic. Parents or our guardians provided active permission. What that means is the information was sent out to the parents in ways that they would make sure that it was received, and then they actually had to sign and approve the participation, or active information, passive permission. Information sent out to parents, and if they didn't send back their objection, then it was assumed that they gave permission. And it really depends on the school board and what they require. So the students who did give permission were invited to participate on the day that the data was collected in the school, and they are all given an opportunity to refuse. The survey is administered by teachers in the classrooms according to a defined protocol. And Joanne, if I say anything wrong, please correct me. But
it's all right,
because you're the one who knows this. We collected data from October 2014 to May 2015. Questionnaires are in French and English. And we ask a range of questions about tobacco, alcohol, and drug use, and then a range of socio-demographic variables. Some examples are here: school connectedness, bullying, gender, ethnicity, and so on.
But not sexual orientation.
Not sexual orientation, which I have been trying and lobbying Health Canada for now 8 years to have that question added, because we know that cigarette smoking in particular is very high in that population, and so it's really an equity issue, and yet we can't ask those questions. So I'm hoping with the new government, the next round, we'll be able to do it. So we had 336 schools from 128 school boards. 47% of the eligible schools approached agreed to participate. So the percent of agreement is quite variable across the country. We have had a very good success rate in BC, thanks to Joanne. Total of 42,000 students, and 66% of the students who are eligible agreed to participate. So what I'm going to be reporting here today are just some basic descriptive statistics, and I'm going to be talking about the multivariable logistic regression, which is really predictors of e-cigarette use when taking into account a range of other variables. So I just want to show you the decline in current smoking in Canada and in BC. So you can see that since 2008, BC had a higher rate of regular or current smoking than in all of Canada, and that declined and then dipped down below the Canadian rate in 2012-13, and then increased just slightly above that. However, there is some sampling variability there, so those figures need to be interpreted with caution, and there's no statistically significant difference between the BC and the Canadian rate. So overall, we've got a downward trajectory of smoking, regular cigarette smoking. And just this is just another interesting little bit of information. Use of little cigars or cigarillos, and this also, I believe, includes hookah and something else, I forget. So that also has declined over time, but between 2012-13 and 2014-15, there's a bit of an increase, and most of that's actually accounted for by hookah use. So just to give you a quick overview of the main smoking variables in the study and looking at declines over time, the top row there, do I have a little pointer? Yes. So the top line there, you can see that back in 2008-9, the rates of current smoking, that means like regular cigarette smoking, and I'll tell you, if people are interested, I can pull out how that is actually defined. But you can see that in 2008 in BC, it was 8.7% of the school population, middle and high school population, were current smokers. If you look at today, or 2014-15, you can see that it's declined to 3.9%. And for all of these, the rates between BC and Canada, particularly for the smoking, are not statistically significant. I'm going to just skip down to e-cigarette use. We don't have long-term trend data because this is the first year that we've had the questions about e-cigarettes on our survey. But you can see that e-cigarette use in the past 30 days is 7.1%, whereas the Canadian rate is 5.7%. But that's not statistically significant, that difference. Okay. I'm just going to move on because I can't cover all of this. So turning to e-cigarette use nationally, ever use of e-cigarettes was 17.7% in our survey, and use of e-cigarettes in the past 30 days was 5.7%. And those are the 95% confidence intervals. Now, what is interesting here is that the measures that were used are actually not particularly good measures. Ever use of e-cigarettes means somebody could have had one puff on a vaping device, or they could have done more. And use in the past 30 days is also, it could be just once or twice, it could be more often. So it's not a very sophisticated or a specific measure. And unfortunately, at the time we were arguing with Health Canada to have these questions put onto the survey, these were the two most commonly used measures on all of the international surveys. Very few surveys had developed better measures to get at a more fine-grained analysis of the use. So this year, we're actually out in the field right now gathering data for this next round, and we have a much better set of questions on e-cigarette use that actually can allow us to do a more fine-grained analysis and we can say that people are regular users, or they've only used it once in the last 30 days. We could do a little bit better analysis on that. You can see that males have tried and used in the past 30 days more than females, and that's a statistically significant difference. I'm not going to spend too much time on this except to say that for both ever use and past 30-day use, as students get older and move up in the grades, the rates of use increase. So that's not a terribly surprising finding. But when you get to grade 12, you can see that almost 30% of high school students have tried. 8.7% have used in the past 30 days. And then we've broken it into 6 to 9, the younger group, and then the older group. And you can see there's quite a big difference between the younger students and the older students, not surprisingly. In terms of ethnicity, you can see that Aboriginal youth have the highest rate of ever trying an e-cigarette, as well as the highest rate of using in the past 30 days. The next group would be Hispanic, and then white, and then black, and then other, Asian being the lowest. So it's interesting, it would be very interesting to do some more detailed analysis to figure out what's going on there.
Are those Canadian rates or BC rates?
Those are Canadian rates, yeah. I haven't got all of the BC rates for all of these yet. Too many analyses to do.
I'm just thinking with the Asian, it might be the fact that male homosocial smoking, where you share cigarettes together, doesn't work with a vaping device. So maybe that's why the rates among Asians seem to be so much lower.
Well, we also
Might be a
know
cultural factor.
that cigarette smoking rates among Asian youth are actually among the lowest as well. But that's a good point, Renee. Rural youth tend to, higher rates of rural youth have used e-cigarettes both ever and in the past 30 days. When you look at the provincial variation, there's actually quite a remarkable variation across provinces. And we're starting to dig into some provincial level analysis to try and figure out how, what might explain the differences across provinces. Newfoundland has the highest rate of ever trying e-cigarettes, as well as the highest rate of past 30-day use. Interestingly enough, Ontario and Alberta have the lowest rates of e-cigarette use. There is a study going on right now, a cohort longitudinal study that's trying to get at the issue of does e-cigarette use precede or lead to cigarette use, and it's being done in Alberta and Ontario. So we've got the study that's trying to answer that question is actually being done in the provinces with the lowest rates of the lowest rates. So I'm not sure how useful it'll be for the rest of us, but in any case, you can see that there's considerable variability across the province. BC, as I previously mentioned, 19.2%. So BC is getting up there.
Can I ask, Marjorie, how stable are these estimates in the school survey? Do they jump around from year to year?
Well, we only have them for this year.
This is the first one, but
first.
all your other smoking data, how stable is it year by year? This is self-report data.
It is self-report data. Some years are more stable than others. I mean, from year to year. In some years, there's sampling variability that makes us question what's going on. But generally, they're pretty stable. But they vary from province to province.
But within a province, so if you've got, like, supposing this is smoking, let's say in Nova Scotia is 20% this last time. If it was a smoking thing, what would it jump around? 17, 18, 23, 24? Or was it always like within 1 or 2%?
No, I think it does jump around a little bit more. I did another study quite a few years ago, and we found incredible variability across the province, from north to south, east to west.
Well, I meant year to year more than anything.
Yeah, okay, year to year. We only had data from 2 data points, and it was pretty stable.
Okay.
Yeah.
But are you asking if cigarette smoking's gone down?
Well, no, I have a general skepticism about survey data.
Yeah.
And because we look at alcohol sales data, and we know that the surveys account for about a third. You look at the drinks people report in the surveys, and you get a lot of variability. There's so much underreporting and poor, and just not, anyway, the sampling, the response rates. The school surveys are much better because you've got a classroom.
Well, they're captive audience.
Yes.
But I mean, that's definitely a very good point. And now with smoking starting to be more stigmatized, people may not be reporting as honestly as they might have in a day when smoking was more common, it was more accepted.
In Australia, we looked at comparing cigarette tobacco sales data with self-report, and we found it was about 70% coverage from the surveys. Do you know what it is here?
I can't say. I don't know. Renee, do you know that?
I've never seen anything.
In You never seen that done? This is a huge problem in alcohol research.
Yeah.
Anyway,
I know
so-
for pregnant women that less than 1 in 4 pregnant women who smoke will actually report that to her doctor.
Well, I mean, Tim raises a very good point about, I mean, survey data. It's not ideal, but for this kind of surveillance,
Hey,
it's
we need
really
it.
all we've got.
I just want to know
Yeah.
how good it is,
Yeah,
that's all.
yeah.
We do need it.
Good point. So this is, to me, the interesting data. E-cigarette use by smoking status and use of other tobacco products. So current smokers, 75% of current smokers report that they have used e-cigarettes. 46% have used them in the past 30 days. Former smokers, 77% report having ever used, but it drops right down to 20% in the last 30 days. Now that is, to me, quite interesting when you've got this, you know, you've got similar rates here between current and former of ever using, but using them in the past 30 days, those rates are always lower than ever use, but when you look at how much difference there is between these two, that suggests to me that this group, the former smokers, may be using e-cigarettes to help them with cessation. So, and there's some other data that does say that's one of the reasons why young people are using e-cigarettes, is to help them quit. We don't have that question in this survey. In terms of trying other tobacco products, you can see the data there. If they have used water pipe, smokeless tobacco, little cigars, there's fairly high rates of having tried or using in the past 30 days.
Can I ask what you mean by susceptible
Okay, I'm good.
and not? What does
Yep,
that mean?
I will tell you what I mean by that. I meant to say that. Let me just get my definition of susceptible out here so that I can tell you. If there are 3 questions that we ask. We ask those who have never had even one puff of a cigarette whether they think they might in the future smoke a cigarette. We ask them if a friend has given them a cigarette, would they smoke it? And then the third one is, Renee, do you remember? Third one is, do they think they're going to have a cigarette or smoke a cigarette in the next year? And then the responses are probably not, definitely not. And then those that answer definitely not to all 3 of those questions are defined as not susceptible to smoking. So you've got those who say that they've never smoked, but they're susceptible because they say they might try a cigarette in the next year. They say they might smoke one if a friend gave them to
But they
them.
also include in that susceptible category when some kid would say, probably not. If a friend offered you a cigarette, would you smoke it? Probably not.
Yeah.
Probably not still is classified as susceptible.
Yeah, so
You
the
have to
only-
give the definite no
Yeah.
to be able to be the non-susceptible category.
So they err on the side of what's the word I'm looking for? Yeah, it's a conservative estimate. So that's what that means. So those who have never smoked and say they definitely don't intend to smoke are much less likely to use e-cigarettes. In terms of perceived access, those who think it's fairly easy to get access to an e-cigarette, 32% have ever used, 10% have used in the last 30 days. And then if they think it's very difficult, they're much less likely to either try or use in the past 30 days. Similarly, for perceived risk of harm, those who perceive a greater risk of harm are more likely to have tried e-cigarettes than those who perceive no risk at all. No, that's the wrong way around. Those who perceive great risk are less likely to use. Those who perceive no risk are more likely to use. Sorry. So in terms of our regression analysis, in summary then, females are less likely than males to smoke, and the odds ratios and the confidence intervals are there. Those in a high income bracket are more likely than those in a middle income, and the odds ratio is 1.63. All of these are statistically significant at least the 0.01 level. Those, again, who are current smokers are more likely than never smokers not susceptible, and they're 13 times more likely than those who are never smokers not susceptible. Former smokers, again, are 3.36 times more likely than the non-susceptible never smokers. And you can see the other ones. You know, there's considerable variability from across the provinces, with New Brunswick, or Newfoundland, New Brunswick, Manitoba rather, not New Brunswick, BC, Quebec, and Nova Scotia more likely than Ontario at about 3.77 of an odds ratio.
I was just wondering from a few slides before about the provinces, were the smoking rates higher in the, was there a relationship between, say, Newfoundland vaping use was cigarette use higher and years prior?
Yes.
Oh, okay.
There is a strong relationship between smoking and vaping. Mm-hmm. In provinces that have high rates of cigarette smoke, they have higher rates of vaping, on average. So this analysis just got run. We haven't got to have time to get the confidence intervals, but I just wanted to have a quick look at the order of initiation data. So we asked students, which did you try first? Smoking a cigarette or an e-cigarette? And so you can see that those who have never tried either one, that's about 75%. Those who have only tried a cigarette and never tried an e-cigarette is about 5.7%. Those who have only tried an e-cigarette and never a cigarette, that's a little bit more. And I mean, there's some evidence now that it may be that e-cigarette use is now replacing, or they're substituting it for smoking and have no intention of ever smoking but are using e-cigarettes. Those who have tried both and tried a cigarette first, you can see that the rates are quite a bit higher, 7.1%, versus those who tried both and tried an e-cigarette first, which is only 6.6%. But the numbers are so small that there's really very few people who actually tried both and tried an e-cigarette first. So the numbers are pretty low. They're higher for those who tried both but tried the cigarette first. So this information provides at least some support. It's a cross-sectional study, so we can't say with any degree of certainty that there's no gateway effect, but we can say that this data supports that that conclusion, that it isn't looking like it's strongly likely that there's a gateway effect going on. And I just thought I'd throw out the alcohol and drug use because people from CAR-BC are here. I was reporting on smoking and e-cigarette use, but I thought you might be interested in alcohol use in the past 12 months, binge drinking, cannabis use, and other pharmaceutical use. So what you can see is, whoops, pressing the wrong thing, a decline from 64.3% in 2008 in BC down to 38.2% in 2014-15. So a decline over time of alcohol use in the past 12 months. I'm not familiar with this data at all, so I haven't really dug into it. So some of you who are more familiar with studies of alcohol and cannabis use might be interested in getting hold of some of this data. You can see that binge drinking has also gone down over time. Cannabis use has gone down. There's been a little jump from 2012, 2013 to 2014-15 in BC. Does it say whether that's, no. I don't know if that's statistically significant or not. I haven't run those analyses. But you can see that generally there is a decline in alcohol and drug use.
I'm surprised with the cannabis, I must admit.
Yeah, I was
My
kind of
initial
surprised at that
reaction
too.
I thought it would have been the other way around. It's interesting.
Yeah, it is interesting. So, I mean, I would be really interested to kind of, I'd like to look at e-cigarettes in relation to cannabis use and dig into some of the other, sociodemographic variables to look at that cannabis use. But I'm competing for the data with a whole bunch of other colleagues who are trying to get at that data. So they're kind of letting me have at the e-cigarette stuff, but not so much this others. Okay, and I think, so what my plan is for future analysis that I think will contribute to what we know about e-cigarette use is that I'm very interested in examining common factors in both conventional smoking and e-cigarette use to explore what's called the common liability hypothesis. So when you see a relationship between e-cigarette use and cigarette use, one theory is that there are a number of common factors underlying both e-cigarette use and cigarette use that might explain that, not a gateway effect. So I'm interested in doing that. I'd like to look at more detailed analyses of vaping and its correlates among specific marginalized populations. We do have data on indigenous, low-income, poor neighborhoods, examining the relationship between e-cigarette and cannabis use. And then we have another study going on because we could not get the question about sexual preference or sexual orientation into the CSTADS survey. In 7 provinces, we were actually able to get an insert into the CSTADS survey that asked that about sexual preference. We didn't get it in BC, but we did get it in 7 other provinces. So we're just about to start that analysis to start to look at smoking and e-cigarette use in that particular subpopulation. So, in conclusion, rates of e-cigarette use are on the rise in Canada. Cigarette use is on the decline. Roughly the same proportion of students have tried vaping as have ever tried vaping as have ever tried a cigarette. The most significant correlates of past 30-day use include gender, high income, smoking status, use of other tobacco products, and perceived access and perceived harm. Our data do not support the hypothesis that e-cigarettes are a gateway to cigarette smoking. I mean, you can't exactly say it's not, but you can, the data don't support that hypothesis. We need a lot more research to explore whether there's a causal relationship between e-cigarette use and smoking. And there's lots of ways that we can do that. As we get more trend data, we can continue to compare increase our rates of e-cigarette use with smoking to see whether that decline continues. I know there's some people who believe that we're still early enough in the use of e-cigarettes in this province that maybe in time we're going to start seeing a shift upwards. I'm not sure that's going to happen, but we can look at that with this data. And then some more longitudinal studies that really dig into what's going on around the use of e-cigarettes and cigarettes and what that relationship is. So those are things that I'd like to do, and we'll be able to use some of this data to do that, but probably we'll need to get some other data as well. So that's it.